Hello, Mr. Hudlow. How you doing today?
Good, how are you?
Good, thanks. My name's Jath. I'll be your nurse today, and we're going to be doing an abdominal assessment. Under normal circumstances for an abdominal assessment, the patient would be laying down with their abdomen exposed. For the purposes of our video today, the patient will remain clothed, and also I would have normally come in and washed my hands and put on some clean gloves. So for this video, we're going to go ahead and get started with our abdominal assessment. Mr. Hudlow, if you wouldn't mind lay down on the bed for me, we're going to get started. The first thing we're going to do is inspect the abdomen and make sure that the abdomen has symmetry to it and that it's not distended or anything like that. And so we'll look at it from different angles and just make sure that everything looks okay. And it looks like Mr. Hudlow's abdomen is symmetrical and doesn't look like there's any problems there. We would also at that time inspect for any kind of sores or wounds that might be there, making sure that the umbilicus is where it's supposed to be and looks like it should. Everything is going to be okay for Mr. Hudlow at this point. We're going to go ahead and move on to our auscultation, and I'll be checking for bowel sounds. And we'll start in the right lower quadrant, listening long enough to hear if the bowel sounds are hyperactive, hypoactive, or if they're normal. Moving through all four quadrants. Sounds like Mr. Hudlow has some normal bowel sounds today. At this point, we'll also check for bruits, and with a normal stethoscope, you would flip it over and use the bell side of that. For this particular stethoscope, we'll just use a lighter touch. And we're listening to the abdominal aorta to see if there's any rushing turbulent blood, which would be our bruit. It doesn't seem like there's anything of concern there. So at this point, we'll move on to the next part of our abdominal assessment, which is going to be our percussion. So we'll percuss in all four quadrants to determine what kind of sound we get out of that, and what we're looking for is tympani. So we'll start at the right lower quadrant. And we get a tympanic sound from that, so that sounds good. At this point, we'll go ahead and move on to palpation, where we're going to palpate just below the surface of the skin to feel the structures that lie beneath and make sure there's no rigidity or anything hard in there. Make sure that everything feels like it should feel and it's soft and non-tender. We'll also be checking for any kind of hernias at this point. And so first, Mr. Hudlow, I'm going to get you to raise your head a little bit and bear down so we can see if there's any hernias. And we'll be checking in the groin area, palpating to see if there's any protrusions there around the umbilicus, which are our general areas. Don't feel any hernias for Mr. Hudlow. You can go ahead and relax, and then we would continue to palpate using small circular motions coming through the abdomen just to feel the surfaces lying beneath, or rather the structures lying beneath the surface, making sure everything's okay. Any tenderness or pain, Mr. Hudlow?
No.
Very good. So if we were in the right lower quadrant and Mr. Hudlow decided that there would be some pain there and said yes to that question, then we could try to check for rebound tenderness, where we would actually push a little harder until he could, as long as he could bear it, and then we would let go rapidly. And if there were more pain, or pain that increased at that time, we could note that there was positive rebound tenderness for Mr. Hudlow. But he seems to be okay at this point. And so from here, we'll move on. Some people are ticklish, and it's a little easier to palpate the abdomen if they have their knees raised. In this particular case, Mr. Hudlow's knees are already bent slightly, so it's easy for me to go ahead and palpate that. At this point, we're going to check our last thing, which I'll get Mr. Hudlow to go ahead and sit up for me, please, sir. And we're going to check the costovertebral angle, which is included in the abdominal assessment sometimes. And so we're going to come down to where that angle is, place our hand there, and give a light knock. Any pain there, Mr. Hudlow?
No.
And on the other side, any pain there?
No.
No pain noted, which would be normally checking for kidney pain. And since he has none, that would actually complete our abdominal assessment. Thank you so much, Mr. Hudlow.